Wild Rose has been calling for a fee-for-service and a chief medical officer for every acute hospital with the authority and responsibility to operate our hospitals properly. When I asked the minister on November 22nd, he said hospitals already have, quote, a clinical lead and also a site admin lead. In other words, there are people with local responsibilities that also have the local authority to act. This is false. Yesterday, Dr. Eagle agreed with us, saying we have to give hospital administrators more power to make decisions. What does the minister have to say for himself?
Honourable Minister.
The statements that I made are true, and so too are the statements that Dr. Eagle made. It's just well known that hospitals, acute care hospitals, which is the subject here, have a clinical lead person. That's a medical type person, and they have a clinical lead administrator. Now, the question is, the responsibility and the authority need to be augmented, and we've said we're going to do that. What confusion could you possibly have in your own mind? I don't know.
Confusion is in your
No
mind.
wonder Albertans are frustrated and confused. You're frustrated and confused, and your administrators are frustrated and confused. It's time to end the confusion. The Super Board is imploding before our very eyes. Even the people on it can no longer defend it. Dr. Eagle also admitted yesterday that the Super Board has confused administrators, and he insisted that the system needs local innovation and autonomy. When will you dismantle the failed Super Board?
Honourable Minister.
Mr. Speaker, the Super Board is, he's referred to it, is actually the Alberta Health Services single regional health authority. They are working very hard to address problems that exist in the system, and that's why we work collaboratively with them, with the College of Physician Surgeons, with the College of Pharmacists, with the Karna United Nurses folks, and also with the Health Quality Council to arrive at a plan. That plan, which talks about specific performance measures that address these issues, is right there. And it was released yesterday, and it will be followed, and it will make the improvements that we say.
The honourable member.
The evidence against this minister has piled up for weeks. Claiming to be blindsided by the ER crisis, he still hasn't admitted how bad the problem is. He's withheld information, and in the last week he's desperately turned to scapegoating his CEO and his parliamentary assistants. The best he can do is wave around a Christmas wish with a target that can never be met. The Super Board is crumbling, and his reputation is crumbling with it. Even his bureaucracy has lost confidence in him. To the Premier, how long can you stand by this minister, and when will you replace him?
The Honourable the Premier.
Mr. Speaker, I'm going to stand with my minister and support him, because you know why? Because, Mr. Speaker, I think all Albertans. Sorry, I know this is the normal behavior.
You have the floor.
Thank you.
Attention will be provided, or I will simply ignore those who are heckling in the question period rotation.
Thank you.
Proceed.
Thank you. The reason I'm saying I'm standing behind my minister, because all Albertans need protection from a member that just got up and he says what we need to do in this province is charge a fee for service when people enter emergency rooms. That begins to worry me, and I really want to know where that party stands in terms of this two-tiered European-style healthcare system.